Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for people with irritable bowel syndrome, IBS. Tip number 1, know when to suspect when you might have irritable bowel syndrome. Irritable bowel syndrome is characterized by crampy abdominal pain, and you can either have constipation with it or diarrhea. And some people alternate between constipation and diarrhea. So it's crampy abdominal pain that's associated with either diarrhea, constipation, or both. It is the most common gastrointestinal diagnosis there is. And the good thing about it is that though it's chronic, it doesn't get progressively worse, and it has no effect on your lifespan. It affects up to 15% of the population. It is the number 2 reason why people miss work, just behind the common cold. So tip number 1 is when to suspect you might have IBS and knowing how common it is. Tip number 2, keep a diary. If you suspect that you may have irritable bowel syndrome, before you visit your doctor, keep a 2-week diary. In your diary, you should write down every time that you have your crampy abdominal pain. Record the time that it occurs and the date. Also, write down the time and the date for all of your bowel movements. With each of your entries for when you have abdominal pain, write down what you did or what you ate or what you drank before the abdominal pain started. For instance, if you had a cup of coffee, write that down. If you had milk, write that down. If you were feeling under a lot of stress, write that down. So when you go to your doctor in 2 weeks, you'll have a food log, and maybe together both of you will be able to figure out what makes your first of all, if you have IBS, then you'd be able to decide with your doctor what might be the cause. So tip number 1 is identifying when you might have irritable bowel syndrome. Tip number 2 is keeping a 2-week food log when you have your abdominal pain, as well as a log of any of stressful events or anything you might drink before your abdominal pain. Tip number 3 is to see your doctor. Having a relationship with the doctor if you have irritable bowel syndrome has been shown to be one of the most helpful therapies, just having a relationship with your doctor for people with irritable bowel syndrome. Also, it's important to exclude other causes of constipation, abdominal pain, or diarrhea. This is especially true if you have what are called alarm symptoms. If you have any of the following symptoms, it's important to see your doctor right away, and there'll be more of an investigation into the cause of your symptoms. The alarm symptoms include any rectal bleeding, pain that's getting progressively worse, pain that has woken you up at night, if you have unexplained weight loss, if you have a family member with colorectal cancer, or if you have a family member with inflammatory bowel disease, such as ulcerative colitis or Crohn's. When you meet with your doctor, most likely you'll get some labs drawn to rule out other causes of your symptoms. These usually include a blood count, electrolytes, and your doctor may also test your stool for bacteria, and may also test you for celiac disease. If some of the lab work suggests a diagnosis other than irritable bowel syndrome, you may also get an X-ray, a colonoscopy, or a sigmoidoscopy, where your doctor is able to go in and get a tissue biopsy to explore the possible cause of your condition. And make sure when you go see your doctor to bring that food log so that you can go over the possible triggers of your symptoms if in fact you conclude together that it is irritable bowel syndrome. Tip number 4 is once you've arrived at with your doctor the diagnosis of irritable bowel syndrome, try 2 weeks each of restricted diets. Often, irritable bowel syndrome is caused by made worse by particular kinds of foods. So a 2-week period where you don't eat any of those foods can be very helpful in determining if you have any possible food triggers to your symptoms. So do the following. For 2 weeks, go without caffeine and see how your cramping abdominal pain goes. After those 2 weeks, go with a lactose-free diet, so especially milk and ice cream. Exclude it completely from your diet for 2 weeks and see how your symptoms are. Next, go for 2 weeks. This is if you have a lot of gas. With a diet that's low in foods that cause gas. So exclude beans, onions, celery, carrots, raisins, bananas, apricots, prunes, Brussels sprouts, wheat germ, pretzels, and bagels. See how excluding all of these gas-forming foods affects your symptoms. After that, do a 2-week gluten-free diet. Gluten-free meaning excluding all wheat from your diet. See how this affects your symptoms. And lastly, try a low carbohydrate diet. Specifically, it's called a FODMAP, a low FODMAP diet. FODMAP stands for fermentable oligo and di-monosaccharides and polyols. There has been research into the cause of irritable bowel syndrome being linked to these types of carbohydrates. I suggest that if you have gotten to this point in food restrictions and you're trying this diet, that you either Google FODMAP to find out what are the common foods to avoid, or you ask your doctor about a list of foods to avoid. There are so many foods it would take too long to list them here. So let's say you've tried restricting each of these food groups at a different time and you're still having crampy abdominal pain with constipation or diarrhea. The next step, and actually something you should be doing no matter what, is regular exercise. Remarkably, regular exercise has been shown to help people with irritable bowel syndrome. In adults, this means at least 30 minutes a day every day, and walking at a brisk pace is enough. If you are overweight or obese, then you should be walking or doing exercise at least an hour a day on most, if not all, days of the week. So we've gone over how to identify irritable bowel, keeping a food log to see what might be causing your irritable bowel, seeing a doctor, trying restricted diets, regular exercise. The rest of these tips are medications or supplements. Tip number 6 is psyllium, which is a fiber. Psyllium is great. You might not think it tastes great. I eat it every day and I think it tastes great, as well as has so many benefits for your health. Not only does it have fiber, which is important for regular intestinal function, but it also lowers your cholesterol. Psyllium powder has many different, comes in many different varieties. You can just buy it as powder and add it to cereal, or you can add it to juice or water. It also comes in a lot of prepared foods, crackers, wafers, and such. So I recommend a psyllium powder, the equivalent of 1 teaspoon a day. That's to start off. And then increase or decrease the amount you take based on whether it's helping your symptoms or not. Tip number 7 is 3 as-needed medications that can help with the symptoms of irritable bowel. For cramping, I recommend dicyclomine, 20 milligrams, up to 4 times a day as needed. Another good antispasmodic or anti-cramping medicine is hyoscyamine. This dose is 0.125 to 0.25 milligrams 3 to 4 times a day. Try dicyclomine and then try hyoscyamine and see which one works better for your cramping. If you have diarrhea with your irritable bowel syndrome, you can try loperamide, 2 milligrams every 4 to 6 hours as needed, up to 12 milligrams in 24 hours. Tip number 8, try an antidepressant. There are 2 classes of antidepressants that have been shown to help people with irritable bowel syndrome. These are tricyclic antidepressants and selective serotonin reuptake inhibitors. Tricyclic antidepressants are better if you have diarrhea associated with your IBS. Selective serotonin reuptake inhibitors, SSRIs, are preferred if you have constipation associated with your irritable bowel syndrome. I recommend the tricyclic nortriptyline because it's one of the least side effect causing of the tricyclics. The tricyclics can cause you to have difficulty sleeping and can lead to confusion, can make your mouth dry. Nortriptyline is one of the tricyclics with less of these side effects. So start with, this is a prescription, so you'd be talking to your doctor about it. But the recommended starting dose is 10 milligrams at bedtime. And you can increase this every week up to a maximum dose of 75 milligrams per day. And the dose should be adjusted just to how much relief you're getting compared to how much side effects. So you don't want to have too much side effects, so that limits the amount, the dose you're taking. Again, if you have constipation predominant irritable bowel, then a selective serotonin reuptake inhibitor can be tried. I recommend paroxetine, controlled release. Controlled release has less of the side effects than the immediate release paroxetine. And I recommend, and paroxetine among the SSRIs has one of the least problems with your stomach in terms of side effects. Other SSRIs can cause you to have upset stomach. Paroxetine controlled release is one of the least likely to cause side effects like this. I recommend 25 milligrams as a starting dose at bedtime. You can increase the dose by 12.5 milligrams about every week to a maximum dose of 62.5 milligrams per day. Tip number 9, a trial of rifaximin. Rifaximin is a non-absorbable antibiotic, so it doesn't actually go into your bloodstream. It works on the bacteria in your colon. And it's especially good if you have irritable bowel syndrome that's associated with a lot of constipation and bloating. It's possible, it's thought, that rifaximin given for 2 weeks at 550 milligrams 3 times a day can reduce the bacteria in your colon that are causing gas to be produced. Again, this is a prescription medication that you should discuss with your doctor. And it's really only recommended if you've tried the FODMAP restricted diet or the low carbohydrate restricted diet that I discussed earlier, and that has failed to help your bloating and constipation. So I've covered 9 tips for irritable bowel syndrome. 1 is identifying irritable bowel syndrome. 2 is keeping a food log to identify what could be making your irritable bowel syndrome worse. 3 is seeing a doctor to make sure that it is irritable bowel syndrome and to exclude other causes. Tip number 4 are various trials that you should make of restricting different types of foods in your diet. Tip number 5 is doing regular exercise. Tip number 6 is eating psyllium fiber. Tip number 7 are the as-needed medications, hyoscyamine, dicyclamine, and loperamide. Tip number 8 are trials of antidepressants, specifically SSRIs and tricyclic antidepressants. Tip number 9 is trial of rifaximin. And tip number 10, believe in yourself. Irritable bowel syndrome is an extremely common condition in this country. It does not get worse. It does not lead to a decreased lifespan. There are many effective options, including having a good relationship with your doctor, that help irritable bowel syndrome. And I made this video as a further aid to your condition. I hope these tips have been helpful. Thank you very much for listening, and have a great day.